Hi, everybody. Good evening, or good morning, or good night, wherever you are. Hello, everybody. Welcome to this forum. It's the Mental Health from Burnout to Brilliance Forum. And that theme was coined by Dr. Priyanta Ravi from New Zealand, and she's here to share with us. We also have on our platform this evening or this morning, wherever you are. I'm gonna just say it because we're all mixed up in this thing called time and space. We also have on our platform Miss Michelle Tolonil, and she is the representative for the Global Jamaica Diaspora Council, Northeast USA. And you heard Dr. Priyanta Ravi already named. She is a neuropsychologist. She's also Alzheimer's disease and dementia specialist. She has some other credentials behind her name. I'm going to get her to share in a little while. Um, First, we want to welcome everybody on the platform. This is your platform where you share with us, and we also share together some of the things that we're going through. And primarily, this forum is focused on mental health and specifically on the burnout aspect. But we're changing our yeah, like kind of perspective from burnt out to how can we turn it into brilliance. And Dr. Prianta is going to go through that in a more detailed way as the expert in this. Um, so welcome everybody. We have quite a wide range of people here from across the region and the globe. Welcome one and all. And we are hoping that you will learn something from this forum, but not just learn, adopt some of the new ways or creative ways of looking at mental health from burnout to brilliance. So welcome all. So to start us off this evening, I am Dr. Dwayne Dice. I'm the CEO and founder of Education Solutions International. If you need more information on ESI, Education Solutions International, you can visit our website at edusolutionsintl.org. That's edusolutionsintl.org. And you have tons of information on there on forums and workshops that we cater to right across the region and the globe. So welcome. Now, first up, I want to welcome my dear friend here, Miss Michelle Tolonil. We have done quite a few of these forums or workshops, or inviting her on EduTalk at times to share the spotlight with me. And so I want to welcome her this evening, not as a stranger, but to greet everybody and to tell everybody, for those people who are joining us, especially maybe from Europe or the rest of the world, who are not familiar with her so much, just to share a little bit about her and her work in the diaspora. Welcome, Miss Tolonil. It's really good to share the platform with you for a little while.
Yes, good evening, and thank you very much for the invite. It's an honor to be here. But if you do allow me, I do have some individuals that came on as a result of my invite. So I just want to give a shout out to them. So I
Please.
see
Yes.
so far Jennifer James, I see Barbara Wilson, I see Reverend Nielsen, who is also part of Health for Faith. And let me just want to make sure I don't leave anybody out. I see. Oh my. Okay, you're this. Give me one sec. Stafford Grant, thank you for coming. And if I miss anybody else, I'm just not seeing you on the screen at this time. But I do want to thank you all for supporting us at this time. Oh, Maureen McFarlane, thank you so much for showing up. And they are all work with me directly and indirectly as diaspora rep for sectors and state representatives. So I just wanted to say welcome and thank you for them showing up and thank them for their support. So what have I done for the last 2 years and 10 months? That's what you're asking me to put in 5 minutes. Okay, Dr. Dice. So
You can take a little bit more. Yes.
Yeah, it has been an interesting journey. I am all about education, like you are. So whatever it is that I can do that is going to support my goal on education. There are three things that when you think of diaspora representative, we always want to do. It's engage, educate, empower, and then being collaborative, right? And so since you are education, let me talk about education, what we're doing. So we realize both here and in Jamaica, because we do work both here and in Jamaica, and we find that we never want a child to go to school without not having necessary resources, right? So for the last 2.5 years or so, we have been intentional about providing the resources that they need. So we have back to school drive, we have laptops to make sure they have the tools. So when the teachers are there, that part is taken care of. One thing I am big on is if I go to the store, I am talking to someone and they give me an idea about something that need to be fixed. The next thing I'm doing is try to host a forum to address the issue. So, like for example, you have one on mental health. I'm also having one on mental health on November 10th because it is a subject matter that recently I have gotten a lot of calls on individuals who are dealing with depression because of this time of the year. It's Thanksgiving, it's Christmas. They might have a death in the family, and it's the first time they're going to have Christmas and Thanksgiving without that family member. And we realize that this time of the year also we know depression is there as well, and there's this ideation of committing suicide. So we realized that there was a need. Where also there are changes as a result, not more state but federal, regarding remittance. That the laws are going to be changed effective January 1st, 2026. So I'm having forum on that next week to have a discussion. So when January 26th comes, you know exactly how this change will affect you going forward. So that is what I do regarding forum. You name the subject matter, I will find expert, including yourself, to come on and educate people how we get around this. The other thing that I loved and I enjoy doing is what we call a cozy chat, Dr. Dice. This is to highlight individuals in the community in the 14 states that are doing the work, but nobody knows their name. You know, you remember that Cheers, you go where everybody know your name, that comedy. So it's kind of that idea. So I want those individuals in the neighborhood that nobody knows about and come on and talk about what is it that they are doing. And from that, we can move on. So those are basically one of the three things that I am very focused on. And as you may know, this year for the first time, we had the Diaspora Conference, a Northeast Diaspora Conference, which was extremely successful. We had a 3-day conference here in Philadelphia in June. I said here, forgetting that I'm in Barbados, not in Philadelphia. So I apologize for that. I mean, in Philadelphia, we had it, and it was such a success that Minister Alanda Terlong has asked us to have another conference in February 2026. So that's what, in a nutshell, that we have been doing, and I hope to continue to do as I seek re-election coming up in November.
All right. Thank you so much. Yes. This is really, really, your hands are full. Your hands are very, very full. And wherever we can partner on anything, you just let us know and we will do it. We'll make it happen.
Thank you.
Um, what are some of the highlights you're going to do in your forum on mental health? Do you have like it's snippets? Because I want to promote it from now.
Okay,
Yeah.
so I want to give you just a little bit because we are still finalizing this entire family that is looking at mental health. So we're looking at it from, as I said, the whole idea of depression and suicide and
Mm.
how that has changed in the 21st century. So that is what we're going to look at. And we also want to look at it from children as well, right? COVID has changed mental health. And so we need to have that conversation. We need to also talk about the signs and what to look and what to look for, so we can, if somebody in our community right now is like one out of every five person might have a mental health issue and we don't know. So we
Yes.
need to address that so you can see it and don't think that, the person is just complaining or you are just being disruptive. No, we need to get to the bottom of it. So we're hoping that the three doctors and psychologists that will be coming on will educate us on what we need when we look out in our community, if we can identify it and what we should be doing going forward. So we are looking for answers. That's not my area, so I don't want to speak to it. But
Yes.
if I am getting the calls about Michelle, depression is real, mental health is real. What is the diaspora doing? Can we have a conversation around it? Hence, and I hope you both will come on and
Mhm.
give your spin so you can help people to see it from a different perspective. I think that's where we are with that issue.
Yeah, yeah, very good. Yes. And we're all in it because it's not like one of those ailments that it doesn't run in my family, so I'm good, like diabetes or something else. Mental health is everybody's business.
Mm-hmm.
So, yeah, so that's very good. All right, I appreciate it and I wish you all the best for because I know it's election season coming up for the diaspora leadership. So, I wish you all the best. I'll be rooting for you
Thank
too.
you.
Yes,
I
thank you
thank you. I
so much.
appreciate your vote in advance.
Oh, yes, definitely. Definitely. Yes, yes. Um, all right, stick around because we might have questions. And for those of us who are in Zoom or on YouTube, you can drop your questions in the chat. For those of us who are on Zoom only, you can raise your hand and we will unmute you and you can ask your question as we go through it because this is everybody's forum, it's everybody's business. So please remember to drop your questions in the chat on both networks if you're on YouTube or Zoom. If you're on Zoom, you raise your hand and we will unmute you and you'll ask your question. All right. So let's welcome. Thank you so much, Miss Michelle Tolo Neal, the diaspora representative. She is the representative for Global Jamaica Diaspora Council, Northeast USA. Now, we're going to invite Dr. Priyanka Ravi, she is a neuropsychologist, an Alzheimer's disease and dementia specialist. She works with different organizations to as it relates to neuropsychology and and Alzheimer's disease and dementia. So I want to welcome her to the platform, and I want Priyanka, can you share with everybody some of the things that associated with your background?
Sure.
Yes.
So as a neuropsychologist, my area of expertise or interest was looking at brain function. And part of the thing that I wanted to really understand is how does the brain behave or react when, suppose, a certain disease or disease pathology starts setting in. And that's kind of what got me interested. So I was seeing the brain more like an engineering instrument. It was a machinery. How does it work? What happens when this engine sort of has issues in it? And how can we understand that so that once we have a clear picture of what's wrong, we can find or devise pathways to basically resolve it. And that's how I kind of got into understanding brain diseases, brain pathology, and finding different ways of resolving that.
hmm Okay, so our focus this evening, I want to talk about something else before the focus. The focus is from burnout to brilliance, and you created a framework I'm gonna share with everybody in a little while you talk. I want you because you're a specialist, and we have had several conversations about this. Neuromodulation, neuromodulation, and dementia, as well as Alzheimer's. Can you define neuromodulation and talk about that as a treatment in itself, where it moves from the pharmaceutical drugs to more of a treatment to help people with pain and other ailments. So talk about that a little bit for us.
Absolutely. So, neuromodulation, as the name suggests, neuro has to do with the brain, and modulation means that we're making changes to it. So when we look at any kind of disease that has to do with the nervous system, so that's not just looking at the physical brain, but all the things that are connected to the brain. So your, you know, movement, the rest of your body functions, it's all wired down to the brain. So you have a peripheral and a central nervous system, and all of that information gets into your brain, which is your CPU, your central processing unit.
Mm-hmm.
Um, what neuromodulation essentially does is once we can diagnose where or which area there's a pathology in, we can stimulate that. And there's two forms of neuromodulation. One is invasive, so that requires surgery, where we probably put some sort of machinery or medication, which then goes and pharmacologically stimulates a particular area with medicine.
Mm-hmm.
Uh, or non-invasively, where there's no surgery involved, and we're stimulating the brain and stimulating certain areas of the brain for a specific activity. So that function, when we stimulate the brain, alters the brain's pathways. And that's very important because every activity that the brain does, there's a network in it, there's a pathway to it. So it seems quite complex at first, but the reality is our brain isn't as tiny as we think it is. If we look at the brain, there's folds in it. And if we look at the surface area, so say if we think of the brain as like a piece of dough, and we roll that piece of dough out and all of
Flat.
those grooves, yeah, and we make it flat, the surface area is massive. And
Mm-hmm.
within that surface area, if we look at it three-dimensionally, there's thousands and thousands more, like millions and billions of networks. And these networks form when basically we activate certain pathways, and we tell the brain that, look, we need to, have this particular output. So that might be, say, picking up a pencil. So over time, once we train that, into the person, or whoever you're trying to train, and this is the same thing with animals as well. That's just a basic phenomenon of how people learn. So when we do the training, the brain fires neurons. Those neurons talk to each other, they activate, and they form a pathway. If we do it long enough, the same movement, it reinforces, and those pathways become solid.
Mm-hmm.
And
Okay.
with neuromodulation, when there's a pathology in the brain, suppose there's a disruption in a healthy pathway, and that's now, being taken over or being disrupted by disease,
Mm-hmm.
we are reactivating the old pathway, the healthy pathway, by stimulating it. So then that alters the disease pathology. And what that does is it helps with your brain function, your cognitive function, which is very, very important when we're looking at things like dementia, Alzheimer's disease, because the cognitive decline is massive.
Mm-hmm.
But it also stops the disease from progressing. And that is a big, big problem with Alzheimer's disease, because the progression is very rapid and it's very fast. So while there are four stages, really it's very hard to say categorically that stage one starts here and it finishes here, and
Mm-hmm.
how quickly people transfer. So it's not always linear. It can go from stage one to stage three in a matter of months or weeks, and you
Okay.
would have no clue.
Mm-hmm.
And the difficulty is when we do this kind of treatment or trying to triage and diagnose patients with cognitive issues, particularly dementia, where basically you're losing brain function.
Mm-hmm.
Unless and until we've got access to investigating the brain, what's inside, is very difficult. And we don't have enough resources world around where we can do imagery, for example, a CT scan or an fMRI,
Mm-hmm.
because that kind of image actually tells us, we can kind of have a look at the brain anatomy in more detail, and that will tell us where the issue is. So, a lot of the times when doctors get to treat patients, or when dementia onset starts, it's only when the symptoms become, noticeable,
Mm-hmm.
that people try and seek medical attention. But by then, the disease would have progressed from stage one to stage three. And from
Right.
stage three to stage four,
Mm-hmm.
that's the only
So,
stop. But,
right. So
so
let me ask you. Um, there's a machine or medication. What does it look like, the treatment?
the treatment. So for
Mm-hmm.
neuromodulation, we're looking at transcranial magnetic stimulation. So there's different kind of devices, but the aim is we're using magnetic stimulation to stimulate aspects of the brain.
Mm-hmm.
It kind of looks like sitting in a chair with a sort of um, I wouldn't say a cap like an ECG, but more like two pieces of, say, like a badminton racket going over your brain.
Mm-hmm.
And the newer devices now, they basically have a monitor that can actually tell you the intensity with which to focus in a specific area. So you can do more targeted stimulation. Obviously, when we're trying to design treatment, ideally, it would be really good to have a picture of a blueprint of what the person's original brain is like
Mm-hmm.
before treatment starts, so we can get an idea of where to start and how much intensity to go in. That's really important. Like with medication, we can't always start with high frequency or high dosage. That is really important. So, what we're trying to do with neuromodulation is try and establish it as a good form of treatment for cognitive diseases and things like dementia and Alzheimer's disease. But at the same time, we're trying to refine the way neuromodulation itself works, because right now we've got the treatment, we've got the devices, we have to come up with very good workflows, including things like, access to imagery, so
Yeah.
that when we try and do the treatment, we can be more precise in
Mm-hmm.
delivering, but at the same time track changes and get real-time feedback that, look, this is the area we stimulated. Usually it takes about 6 to 7 weeks or 6 to 7 sessions. So you have to allow the brain some time as well, to rewire itself.
Right.
And it'll be really good to see that. Not having a visual account of what's happening, beneath the surface, it becomes very hard to treat.
Yeah. Where is it available in the is it available in the US or Canada or Europe? Only in New Zealand where you are now or where? Australia?
No, so neuromodulation,
Mhm.
basically, like I said, there's different people doing neuromodulation now. So we've got chiropractors doing neuromodulation, we've got physiotherapists, some of them are training to do neuromodulation to heal injuries in different parts of the body. Of
Mhm.
course, that doesn't really have to do with altering your cognitive performance, but say, for example, if you have a knee injury and that's affecting your walk, naturally, if you heal the knee with neuromodulation, your connectivity from the peripheral nervous system to your brain improves at the same time. So your recovery is much better, because now your brain knows that, okay, I'm not injured, don't limp, and it can start
Okay.
working better. So
Yeah. Yeah.
even those things rely on neuromodulation. So at the moment, it is very well established, sort of doing neuromodulation for physiological injuries around
Mm-hmm.
the world, very well established in the UK and Scotland, Europe as well. With looking at Alzheimer's disease, yes, now we do have good establishment in the US and the UK, but the problem with the US is it's still off-label.
Mm-hmm.
There's a lot of things when it comes to medical devices and treatment that needs regulation. So the devices themselves, many of them are regulated, so they're safe to use, no problem there. But, it's kind of more like having that tick of approval that yes, whether you are a psychiatrist or, even sometimes surgeons use it in a way that, they've done surgery somewhere, they need to reprogram the body for healing.
Mm-hmm.
They use it as an adjunct for rehabilitation. Sport,
Oh,
physicians, it's the same thing,
yeah.
because really we're stimulating and we're reprogramming the body's pathways.
Mm-hmm.
Now, with the US, because we've got so many states, it's quite fragmented. So
Okay.
the particular device or devices for sort of say uh, treating dementia and Alzheimer's, they are still under FDA review, and they're
Yeah.
looking at the global sort of survey or the global research that's going to conclude on it
Mm-hmm.
to sort of complete, and then they will assess the results. So right now it's off-label in the sense that yes, it's safe. Certain providers can do it. Whether or not insurance, that's the important thing. When things
Okay.
are
Yeah.
off-label,
Mm-hmm.
if we've got insurance companies backing it up because they
Mm-hmm.
also want to, see that this is approved.
Yeah.
Usually when things are off-label, insurance companies don't come on board.
Right.
And that's kind of the problem with accessibility now.
Right.
in the sense that you have to try and make all of this, you know, available and accessible to the patient, but also affordable. So in the US, it's kind of trying to, you know, get in,
Mm-hmm.
but outside the US, sort of like in the Caribbean, yes, it is being, you know, established, and also in South America, in sort of Australia and New Zealand, we're trying to get the sort of focused neuromodulation devices that are just for the brain. We're trying to get them established, but a lot of chiropractors and physiotherapists are using sort of, you know, other devices, sort of the previous models to say, to have the same effect. So that's also there. So there's research coming out now, again, for the same reason. Usually, FDA is considered to be gold standard for regulation. So it's not so much that the devices don't have the approval, it's more that the medical and the device safety authorities are looking for approval of the actual procedure.
Yeah. So let me ask you. So Miss Michelle Tolonil, who was on a while ago, she's asking a very good question. What's the success rate?
The success rate is really good. So when we look at our participants, whether it's, you know, localized studies, so we've basically got clinicians through universities or private clinics, you know, trialing neuromodulation on dementia patients or patients with even Parkinson's disease. So
Yeah.
far the results have been really good. So we're looking at a 95 to 98% success rate, in the sense that
Oh.
we can reprogram the brain so that we can retain cognitive abilities. And this is where things get a bit technical,
Mm-hmm.
because with Alzheimer's disease, there has always been arguments that the pathology has to do with physical structures in the brain. So
Mm-hmm.
we call them the, you know, um, I guess the tau and the A beta school of theory. Some scientists and clinicians believe it's got to do with the tau protein going crazy. The others believe it's got to do with alpha A beta. And that is where much of the energy has been focused on for from say the 2000s onwards. But now we're realizing that those are not the only two reasons why we get things like dementia and Alzheimer's disease. So what we're seeing right now in terms of treatment,
Mm-hmm.
it becomes very difficult to say, you know, when you don't know exact causes or what is the exact cause in a particular patient, that this is the treatment or this is how we're going to remove it, because we haven't actually identified the cause. So how we're dealing with this is we're looking at cognitive function. The
Mm-hmm.
main thing is we need to be able to ensure that we can stabilize the patient's cognitive abilities so that they don't decline. And as long as we can demonstrate that, that is sort of considered treatment or
Mm-hmm.
successful.
Right,
So
right.
when we look at any kind of research that's been, say, being done in, say, Singapore, Hong Kong, we've got research pretty much happening, or, you know, trials happening throughout the world in just about every region, every continent. And that is what we've found. So when we test the person's cognitive abilities before, and
Mm-hmm.
then we do it after getting the sessions, we have seen about 95 to 98% success rate, in the sense that their memory is much better, their decision making is much better, language is much better. So we're not seeing that decline, and
Right.
we're seeing sort of improvement as well.
Mm.
And here's the difficult thing: people usually come to us, you know, when the decline has already happened. So we don't know what their original cognitive capabilities
Oh.
were in the first place.
You can only do it from there
Yeah.
where they came to you.
Exactly, from there. So from
Yeah.
that perspective, that is something we always need to, you know, understand, because for patients, their families, even the audience who wants to understand exactly how this works, it is very difficult to compare something and say, oh, there's an improvement, when we have no idea or no measurement of what the baseline is.
Exactly. Yeah.
Yeah. So when we're
Difficult.
looking at the research,
Yeah. Go on.
when we're looking at the research, we
Mm-hmm.
always look at, you know, how much of an improvement have we had in the person's cognitive abilities from day one.
Mm-hmm.
And the important thing is what we found with neuromodulation and treating sort of dementia and Alzheimer's in this way, we haven't had side effects, which is absolutely
Oh,
important. And this
that's
is
fair.
the thing that stands apart from, say, pharmacological treatments, because Mostly pharmacological treatments focus on symptom relief,
Mm-hmm.
right? And also because Alzheimer's and sort of dementia has become so prevalent, there's a market out there. So right now, because there's different types of Alzheimer's as well, where there's different pathologies, like I said, now we're starting to understand that it's not always one particular thing that goes wrong when it comes to cognitive decline or Alzheimer's. It's a combination. In some families, that's hereditary.
Mm-hmm.
So having that pharmacological treatment doesn't really work because they have been designed on the old framework that it's either this or this, and they either focus on A or B. They don't cover the whole spec. So,
Mm-hmm.
because of bandwidth issues and also side effects that have come into notice from a lot of the pharmacological treatments that they're not actually, very friendly to a lot of people, it's becoming more, understood that neuromodulation, non-invasive, is the
Yeah.
way to go because it allows you to retain your function, you can rehabilitate yourself, it's healing your body, which is very important. But at the same time, you are not disrupting your work life. You
Yes.
are continuing to live at home. You don't need to go into hospital, get admitted, be stuck there. And you can continue life. The important thing in this is we not only looking at the side effects, but also how long can these changes in the brain last? The
Yeah.
thing with the brain is it adapts incredibly fast. It changes. The day you learn something, it starts changing. The
Mm-hmm.
more you practice it, the stronger it becomes. So
Yeah.
when we're looking at pathology, and obviously with dementia and Alzheimer's, we're looking at mature adults, right?
Mm-hmm.
Although these days, the age for people being diagnosed with sort of cognitive decline or cognitive impairment, it's as early as, say, in your 40s, you
Mm-hmm.
know.
Mm-hmm.
So it's not so much an aging related issue, it's actually got to do with brain function.
Yeah.
But they're still healthy, mature adults, right? So
Mm-hmm.
as we physiologically age, the brain's ability to adapt and change or learn it also declines. So we have to make sure that in the particular individual, if we complete the sessions and they go away and they're able to retain. So you retrain the brain, but can those changes still stay in place?
Mm-hmm.
Sometimes you will find that, you stimulate the brain and it responds incredibly well. But once the treatment stops, you'll have a remission
Mm-hmm.
because the stimulation is not there anymore and people start getting those cognitive symptoms again. So in there what we found is again with neuromodulation, as long as we can keep hold of the patient and keep following up with them to see how they're doing, how their cognitive function is going, you can always bring them in and do like a touch-up session, you
Mm-hmm.
know and that helps because that means that even in people where sometimes the symptoms start to crawl back in or the cognitive decline comes back in because they might have a more sensitive sort of cognitive reserve where they need probably longer stimulation so those newer rewired pathways can sort of stabilize. You
Yes.
just bring them in and continue for a little bit longer and you can resolve the problem. So there's no remission as such, unlike sort of
Yeah.
cancer where sometimes we treat the patient, they go away, and then, a couple of months, a few years down the track, it resurfaces again.
Very so. Yeah.
Yeah, and sometimes it's a lot more aggressive. Here, because we're continuing, the remission rate is actually really, really low. So that is a
Okay.
massive plus point.
Yeah, yeah, that's very good. And if people want more information, we did talk about this on EduTalk, on our YouTube channel. I don't remember how long ago, but it's on there if you type in neuromodulation, dementia, or
Yeah.
Alzheimer's with Dr. Priyanta, you will find it there on our YouTube channel. Um, so this is a long stretch. Let's switch and actually talk about the burnout to brilliance focus. Let me see. Mr. O'Neill asked, does the our environment? We're answer this quickly and then we move on. Does our environment and what we eat? This is a very good question, Michelle. Does our environment and what we eat contributes to the problem in terms of the cognitive decline and have to get treatment? And is 40 40 is very young. That's what she said. 40 is very young, or 40s. So, does the environment or what we eat contribute to the decline?
100%.
Oh, Lord. Need
100%.
to change our
So,
foods.
so I'll run you through very quick examples of
Yeah,
both.
right.
Your gut is your first brain, or some people call it
Ooh,
the second brain, but it is your first brain because that is where the nutrients come through. And actually, your neurotransmitters and all the chemicals that are involved in activating your neurons, the cells in
right.
your brain, they're actually made in your stomach. So,
Oh,
if your
my
diet
goodness.
is not good, and that's part of your immune system, actually. So, if your diet is not good, or there's a lot of inflammation in your sort of digestive system, it affects brain function because you're not
Oh,
packaging or you're not generating the right components. You know, you have a weak army, so they can't go and help the brain out. It's like that.
yeah.
So,
So, oh
there's a
my
lot of,
goodness. Listen, we're gonna do a session on healthy foods with the brain
yeah,
health. That's what we need to
yeah,
do. We're gonna invite Michelle back again. This is very good. You can ask the questions and we get some answers. This
definitely.
is really, really good. And I'm trying, once you mentioned it, Michelle, the question, Priyant, I'm starting to think, what did I eat today? Did I eat processed food, ultra processed, ultra processed? So I need to go back and think, I need to change my diet tomorrow morning. Oh God.
Yeah, definitely. And coming back to the age issue,
Yeah,
I'll give you an example why people are now believing it. We've kind of said this from a research scholar, clinician point of view for a very long time, but people are starting to believe it right now. Rugby players, high
yeah,
impact sport, and you know, with any athlete or any sort of sports person, they have very short careers in the sense that everybody comes, they try and play for their teams, whether it's local, national, state level. And really, the tenure isn't very long. They play for 10, 15 years because it's very intense performance. Physiologically, you have to put your
yeah,
brain through a lot and your body through a lot, so that you can, get the results, which is win. And that's how people get selected and they retain their positions. So
yeah,
when you have a short but very intense career and something like rugby or how they say football in the US, you
yeah,
get head knocks, you get very big head knocks, and they're not very good.
yeah,
Because, yes, you've got a massive, strong skull, and that's insulating your brain. There's a lot of fluid in there to keep it protected, but your cells can still get damaged. So, what we're seeing now with rugby and football is that they're saying head contact is like a big no-no. You cannot go and do a massive head knock. Whereas before, these sports were mostly male dominated, so it was a thing of, uh, you know, I guess status that I went and I did this massive head knock to this other person, and
right.
and that's how people would do it because they were trying to show their strength and prowess or intimidation on the field. It was part of a
Mm,
game strategy.
yeah,
Now they're realizing that guys isn't good because you're damaging your cells in your brain. It creates low grade inflammation, and as you age, that affects your cognitive abilities.
yeah,
So, especially a lot of times where those head knocks lead to concussions, the bad thing is it's not diagnosed on the spot. So even if you're looking at a live game, whether it's on TV or in person, they will go. There's no way of doing an accurate assessment and saying, "Hey, look, you've suffered a concussion." Usually, whoever's doing the HIA, which is your head impact assessment, they will just see if you can balance yourself. And
mm,
that's the measure, which is very outdated because that
no,
tells you nothing about the head knock or whether
exactly.
you've got a concussion. So as
Yeah,
long as you can balance yourself, that is declared as being fit to go back onto the field. And
no,
that's where the problem happens because sometimes even the players are like, no, 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 this is a really big game. I want to go.
yeah,
I want to play for my team. And they're like, can you please let me go? So they just show I can balance myself, and then they're onto the field.
yeah,
But you've triggered a response. You're still carrying that concussion, and you continue playing. So that
yeah,
is why those head injuries go unnoticed. And
hmm,
as they age, usually we're seeing this now, they retire and they think that, okay, now I'm going to go and enjoy my life with my family because I haven't been, able to be with them as much as I wanted to while I was sort of focused on my career.
yeah,
They spend a few months and then they realize that, I'm having issues. And a
yeah,
lot of them start developing things like Parkinson's disease, Alzheimer's, cognitive decline.
Mm-hmm.
And the research actually shows that this is a reason why they've had a lot of high intensity traumatic experiences that has altered the brain pathways. And as now they're aging, that trauma is catching up with them and manifesting as sort of dementia.
Yeah, yeah. They actually created it. Oh
Yeah.
man. All right, so let's switch and talk about Burnout to Brilliance. So this Burnout to Brilliance flyer was created by Dr. Priyanta here, Priyanta Ravi, and what it does is to help people move from burnout to start operating on a brilliant side. So you look at yourself as a person, not just probably in recovery from burnout, but you start to change your perspective and living a more fulfilling life, even though you might experience burnout. So, Priyanka, you ready? You
Yeah.
ready? All right, good. So let's talk a little bit about this. What exactly is burnout? Make it simple for somebody like me who really needs simplicity. What exactly is burnout?
Absolutely. So, burnout isn't just exhaustion or stress or fatigue, it's actually long term chronic stress. And the World Organization now recognizes occupational burnout. So, when we say burnout, it's actually got to do with your, occupational, your work life. And it's not really a reflection of your personal weakness or your individual capabilities. So, with that put together, burnout is an occupational phenomenon and it's got to do with workplace stress that hasn't been successfully managed.
Hmm. All right, good. So burnout could, how long will it take though for somebody to feel imagine people here, I'm thinking majority of people, they are not in they're in high stress environment where you have to think on the spot. I'm thinking of healthcare workers and teachers,
Mm.
societies people. In a office related job or a classroom or healthcare, how long on an average day do you think that they would take to feel like, okay, this is burnout?
I think when we look at the emotional symptoms, see, burnout is so massive, and we'll discover this as the session goes. But there's physiological effects of burnout, those symptoms in your body that your body says. There are emotional symptoms of burnout, and there are cognitive symptoms of burnout. The emotional and cognitive symptoms are the ones that actually tell the person that something is wrong. People don't actually go and see a doctor or a nurse when they feel burnt out. It's usually your body starts showing these signs, but you don't pick them up. And by the time you have, emotional and sort of cognitive symptoms of burnout, that's when you realize that there's internal issues. So
Mm-hmm.
for me, the way I would say, you could imagine burnout is if you have been stressed for more than 3 months, where you've had to engage in high concentration, high decision making abilities, you have not had good sleep, good food, or a good routine for over 3 months, you're very much likely to say that you've developed a very stable form of burnout. Anything that's temporary, that's stress. Couple of weeks, a month, 2 months even, that's stress. Once the event is over, your body gets back into normal. The thing with burnout is we're talking about chronic stress.
Okay.
So what it does is it programs the body to constantly be on fight mode.
Mm-hmm.
And when the body is on fight mode, it uses a lot more energy, but it's also focused on survival. So you can't tap into higher cognitive abilities. And that's why I say 3 months is a very long time. So if you're stuck in that sort of scenario where you're firefighting or you're focused only on survival
Mm-hmm.
because of various stresses affecting you, then pretty much you've landed up with burnout.
Okay. Wow. Um, so how do people get out of it? Like you're stressed for a little while and the transition, sometimes we don't feel the transition. We don't feel this transition from being
Exactly.
regularly stressed to burnout. So maybe we should talk about that. How do you recognize, before we talk about how we get out of it, how do you recognize the transition that you're actually in burnout and not just your regular stress.
Right. So it does actually have to do a lot with your self-awareness and also self-report because other people don't really focus in a workplace on your colleagues as much to pick up burnout. And by the time they do, and again, that means burnout has already been established. So
Right.
really, when we're talking about, correct diagnosis that, hey, look, I'm starting to feel as though I'm getting burnt out, as opposed to I am burnt out, reaching that, final stage. The biggest difference is satisfaction. You will no longer feel satisfied doing the things that you would feel happy doing. So in a work environment, this would be, if you're absolutely passionate about your job and you love doing what you're doing, suddenly you're not getting job satisfaction out of it, but you still want to do the same thing. It's not like that you hate it, but you're not able to enjoy it either.
Mm-hmm.
So that kind of emotional fatigue where you're not able to feel happy, not able to feel satisfied and content by doing things that usually would bring you happiness, and you're starting to kind of question yourself, like, why am I not being able to enjoy this?
Mm-hmm.
That's a really big time, like, for one person to sit down with themselves and realize that, maybe I'm burnt out because I'm so saturated that I'm not able to gain anything else into me. It's not so much that, you started hating the things that once gave you happiness. It's just you're not able to feel happy in any way. So what usually happens is people start experimenting that, maybe I'm just bored and I'll try something else. And they start something, completely different, whether it's at work, changing the way they work, changing different projects that they're focusing on, thinking that, it's going to stimulate them and kind of give them that, high in
Mm-hmm.
terms of that job satisfaction. But it doesn't happen no matter what you do. You're not able to feel content anymore. And that affects your relationships at work and at home, socially as well. So that's a very good sign that you have reached burnt out.
Yeah. So if you're going around and saying, I hate my boss, I hate my boss, I hate this work, it might not be burnout. It might just you just disliking the workplace, right?
Yeah, yes,
I
and you
just
will
wanted to throw
continue.
that in there.
So in parallel, you might not be
Yeah.
very happy at work because of
Right.
some issues or some conflict. But if you come back home, say you take your pet out and you really enjoy that, suddenly you'll find in parallel to your working life, the things that you did outside your life don't bring you any happiness either. So usually people enjoy time with their friends and family, or they have a hobby, they go to the gym and they feel really happy. Sometimes, the things that usually people do for, as a stress buster for themselves, they find that even those techniques don't work. And they're sitting there, questioning themselves that, hey, I really used to like, going for a walk or hitting the gym or, going for a swim or
Mm-hmm.
meeting up with friends when I was stressed, watching a movie. Now, when I do the same things, I don't like it anymore. In fact, when you look at something like a comedy film, you might have seen that film, say, 100 times, and you must have thought to yourself that, this is my stress buster, this is my go-to, and this
Yeah.
has helped me so much. Like, no matter how many times I see it, I'll feel happy. Or a piece of music that you really, really enjoy, and no matter when it comes on, you just get involved with it. Suddenly, you just stop reacting to these things and you start wondering to yourself, there's something wrong. It's not the external thing that's the problem. It's still the same thing, right? It's
Right.
still the same film. It's still the same movie. It's still the same song. Why
Mm.
is it that you have not been able to engage with it? And really, it's not so much that you don't like it anymore. It's more that you're not able to connect with it. And that's the problem that we're seeing right now. Burnout leads to disengagement, and that leads to dissatisfaction.
Okay. All right. So walk us through your product here. What caused you to create this based on your experience in your job? And
Yeah.
how, yeah, what are the components of this? How will it help organizations and people individually?
So, from a neuropsychologist's point of view, obviously we talked about neuromodulation and rewiring the brain, and basically all these things happen once, there's a diagnosis. So once we can establish that there is a problem, people come to us, we do a triage or an assessment, we investigate, and we establish the issue, and then we do a treatment plan, right? Now, with burnout, it doesn't always lead to psychological or neurological issues. but burnout itself is still very much, a problem. So what do we do? So for example, a person might not have depression, but they're burnt out. And what I started noticing with my sessions recently, or when I started, Mindwell, is that I saw a number of individuals that were coming to me, and it wasn't that they had, any specific anxiety disorder or depression. So for us, it's very hard to categorize what the problem is when, you don't fit that criteria of having those psychological issues or conditions or disorders, but you're still having psychological problems, you're still suffering. So it got me wondering, and I sort of thought to myself, what's common in people these days where you can't categorize them, it's not really depression or major depressive disorder, it hasn't reached that stage of being established a disorder, but you're still in that sort of step below it, or the phase below it, where there's huge psychological challenges and the patient is suffering. And what was common amongst pretty much everyone was workplace stress. And people were saying to me that post COVID, life has been really difficult in the workplace. And that got me thinking because, I'm from the healthcare sector, and healthcare really is going through a transitional phase. And there's a whole bunch of things happening there, but sort of particularly in New Zealand, we're really struggling with delivery. And I think a lot of other places are. Not necessarily because we have less resources or less people, it's just we have to redesign this whole system so that we can be a little bit more efficient.
Mhm.
So, when I started investigating things like that, I realized that just about every workplace is having the same issue in terms of business. But the problem is, when somebody is having chronic workplace issues, you go to your doctor cannot really resolve those issues. They cannot tell you that you have this particular problem at work or this particular conflict at work that's causing you burnout. Can
Mhm.
you make changes? Because, you know, professionally you're bound to your own section, you cannot interfere in the other person's workplace, and there's a whole bunch of other factors coming in, right? Employers, your own life decisions, where you want to go. How can we then resolve the problem? Because we can't actually, unlike in medicine, when there's a physical problem, we can't actually do anything. We can't access or touch the problem itself. It's very, very much external. And that just leads to, a whole bunch of doctors and clinicians trying to firefight. So we just have to then sit down with the patient and say, look, it's difficult. And, and ultimately, a lot of times people are not in a position to leave their workplaces, or they choose to remain there, like, I've given my life to this, I want to stay here,
Mhm.
which is fair enough. But then if you can't get rid of the problem and you can't treat it, what do you do? So you just left to deal with the symptoms, and we start just, maybe prescribing medicine or therapy, however it may go. But the real problem, the cause of burnout still remains, because it's an occupational issue. And unless and until those occupational challenges are resolved, we can't really claim that we've treated it, because the patient is going to continue going on chronic stress. And then now I've seen so many people go from chronic stress to fatigue to burnout. Again, it leads to a whole bunch of other sort of manifestations of disease, because like you said, your diet gets affected, your sleep gets affected, and sooner or later you actually start developing diseases. So
Mhm.
what's better, the intervention to come earlier and stopping it from becoming sort of, a physiological disease or a psychological disease, or we let it continue? Because from a business aspect, you're employing a lot of people, we're paying a lot more in labor compared to, previous times in history,
Yes.
but we're not getting the same level of productivity out. So when I started studying things from that angle, it kind of, connected the dots. It made sense why people are not able to perform, why people are not as productive, how this is affecting the business aspect of actual businesses, but also delivery. So even if, say, for example, your workplace is absolutely fantastic and you don't have burnout issues or occupational issues at work, but the fact is, you're dealing with so many other businesses that are, where it's your healthcare provider, your hospital, your councils. So ultimately, the thing with burnout is it is incredibly contagious. From one person, it goes into every other person around it. From one organization, it leaks into every other organization. Why?
Mm-hmm.
Because when you go to your council and say, hey, look, this is a problem, if the entire organization is burnt out or the person that you're dealing with is burnt out, you don't get the delivery.
Mm-hmm.
And both people end up getting frustrated.
Mm-hmm.
Your
So
frustration
you're,
might be
yeah,
temporary.
hold on one second. You're saying that this is burnout is contagious.
Yes, absolutely.
Oh wow. Wow.
So it
Yeah.
doesn't, it's not limited to one person. It
Mm-hmm.
starts with one person, it goes on to the teams if they're working more in teams, and then
Yeah.
eventually it spreads into the entire organization. And if
Mm-hmm.
your leadership and management are not aware and everybody becomes disengaged, which is what we're seeing, it
Mm-hmm.
starts affecting your business and all those other people that are, interacting with your business. It can be your customers, it can be your patients, because you're not listening and you're not putting attention into what you're doing. You're disengaged.
Yeah.
And that means you're going to make mistakes, you're going to oversee good opportunities, and that can actually lead to a lot of professional negligence. So
Mm-hmm.
we've found that, a lot of times when we have burnout, disengagement is certainly there in the teams and in the way they function. And sometimes these mistakes can be really, really silly, and you'll be like, it's 101. Why would you do this? But the fact is that when a person is burnt out, they don't see the mistakes. And it
Right.
becomes difficult for a person who's not then burnt out to engage with them. And that's where internally there's a lot of conflict. So once burnout starts, and you've kind of got half people who are burnt out, half people in an organization that are not burnt out, they clash
Mm-hmm.
because one side is disengaged, the other side is engaged. They're trying to talk to a person who cannot hear them. And ultimately, the ones who are engaged get fatigued, and then
Mm-hmm.
the burnout transfers onto them and they switch off
Yeah, that makes
because
sense.
it's stonewalling. It's like talking to a brick wall. No matter how, and that's why I said earlier that it's actually not a reflection of individual capabilities, it is contagious. How long can you imagine talking to a brick wall? It's going to drive you crazy after a point in time.
Most likely, yes. Most likely. So what are the ways that organization, let's start with the organization because there are two levels here, the
Yeah.
organization and then the individual. So if organizations lose productivity out of their workers, the people who work there, how can they change this culture of burnout to a more productive one?
Absolutely. And I think the answer to that has to do with your business design. When you set up your business or when you're operating any business, you need to look at your business design. And that is really important because that addresses what you're actually trying to solve. So, what is your business doing? Are you manufacturing a product? What problem are you solving? What are you trying to actually do? Are you delivering a service? How does it work? And that is very, very important because when people start disengaging, your output becomes really, really weak. Or rather, I say, the focus is more on ticking boxes. So you do get output, but the throughput is really poor. So that's where we have issues with productivity and engagement. Um, a lot of businesses now, post COVID, have to survive, innovate. And innovation only happens when the brain is in a restful state where you can be creative. Creativity actually requires a lot of energy and a lot of cognitive resources because you're focused, your attention, high level intelligence, looking at different details. But when you're burnt out, you just have zero engagement, so you don't have what your cognitive reserve needs to facilitate innovation and creativity, so your business starts going down. So actually, this isn't sort of, like I said, an individual or a psychological issue. There's a massive business component to it.
Mhm.
And how businesses need to look out for it is they need to constantly stop and sort of hold a mirror to themselves and be like, are we actually, on track to what we want to do? Are we achieving the purpose that we have set out for ourselves? And if we haven't, we need to find what our purpose is, design and define it so that
Mhm.
everybody knows what we're trying to do, and then develop a pathway or a structure
Mhm.
where all of the people can be aligned with the business. Your people are your biggest resource. So if your people are not aligned with your business is not going to survive.
Okay.
And this is what we've seen post-COVID, that, we had a big startup culture post-COVID, very massive boom. A lot of people were home and they became very, very creative, not
Yeah.
not stressed,
Mhm.
or at least towards the end of it, they've had more time to think about, doing a side business, or maybe changing employment, and thinking, I'm inspired by doing something else and starting their own businesses. And why they haven't worked out is simply for the same reason, is there's high stakes involved, huge risks. You deal with those kind of stresses that come with a high stakes environment where the decision you're making has a huge impact. And this is the same professionally, for doctors, lawyers. Decision making carries high risk, but it's part of the job. You can't eliminate it.
Mhm.
Somebody's life is going to depend on it.
Mhm.
And dealing with it on a day-to-day basis means that you have to learn to adapt to a high-risk environment. And that
Mhm.
is why it's becoming really important that even as an organization, for example, you might be a law firm, obviously your success will look different. It wouldn't be the same as, say, a manufacturing company where you're looking at how much you've manufactured, how much sales you have. There is going to be a commercial aspect to your business in terms of making sure that the company is profitable. Obviously, that's necessary, but you would also look at the number of cases won. That's also
Mhm.
important.
Mhm.
Um, but what has happened post-COVID is a lot of structures have started changing in businesses, and they haven't really been able to tap into their purpose. They're starting to pick up, corporate templates where
Mhm.
they've had more people in the middle layer and the top layer. But at the same time, there's no structure to align the business to the purpose, and people start getting disengaged. So that's another reason why we're seeing burnout, because the internal structure is not aligned with the business, and that's why we're having so many issues with delivery.
Okay. So it's an org so on the organizational side, they really need to look at organizational structure and their purpose. So that,
Definitely.
yeah, key. Okay, so that's organization. It's actually boiled down to organizational culture, what they're
Yeah.
doing in that organization. What about the individual person? If I find out that I'm burnt out, or there's certain things that I used to do and I dislike them, I feel like throwing up every time I think about that task that I have to
Yeah.
complete. What can I do to assist me in getting over that level of fatigue and anxiety?
See, that's where it becomes really important, because when we're looking at burnout, it is an organizational thing. So
Mhm.
suppose your burnout has to do with the way things are structured. Again, coming back to that corporate example, we're seeing a lot of healthcare organizations, whether it's a hospital, whether there's funding councils, clinics, you name it, but they're starting to adopt a more corporate structure. So it's not like before where, there is a problem, you speak directly to the doctor or your clinician or your nurse, and they're like, oh, okay, I'm sorry, this happened. Let me just go and change it. No. Why? Because they've brought in a corporate structure. The frontline staff, your nurses and doctors, then have to escalate that need up to a specific level, get that approved, and then bring it back down. And once that approval reaches them, that's when they can deliver to you. And that procedure itself is what's burning people out. So for example, if I'm a doctor and I'm sitting in a busy clinic and I'm saying that, the way we're doing this is not good anymore, and I need to be able to make decisions really, really quickly, especially when you're making a clinical judgment, right? Because your expertise has to do with the patient's safety and their treatment. Whereas the person who's going to give you the approval, 9 times out of 10 is non-clinical. And they're probably, coming from a commercial background, some managers and things like that, which is how corporate structures work. They don't necessarily have people who have a background in medicine or in law or in healthcare who are sitting there managing these corporate structures. So they're
Mhm.
just thinking, this is how we do it in the corporate way. You have to get these approvals. So ultimately, it's not so much that you cannot treat it, it's just that you've now been bound to a certain procedure, a certain workflow of working, and you can't escape that. And the problem we're seeing right now is people are giving feedback to the management and saying, hey, look, we've had a really bad month where, this particular process is slowing us down in decision making and we can't get stuff done, but nothing's being done about it. So coming back to your point, it becomes very difficult when, you know, the first layer and the bottom layer are not aligned. They're not able to talk to each other. And it's very important to understand that they need to, if you really wish to have, you know, organizations or structures that are multi-layered, they
Mm-hmm.
need to talk to each other. And that
Okay.
feedback needs to be taken on board. Unfortunately, that's not what we're seeing right now. And while personally you may wish to change,
Mm-hmm.
you know, that, you know, I wish I could do it, but at the end of the day, it's your job. And if you're not allowed to do it, you know, you have
Yeah.
to stay there and do it, or just find another role or go to another organization, which isn't
Yeah.
always possible,
Right.
where you have the freedom to work the way you want.
Right. So that's a hard task for individuals. They'll have to make the
Yeah.
decision personally to take care of
Mhm.
their health personally.
Exactly. And
So,
that's why, you know, when we look at the business aspect of things, burnout has a severe business case because that is what we're seeing right now. People do eventually make the decision like, damn it, this isn't worth it. Because I'm
mhm,
going home, I'm not satisfied, and I am not able to spend time with my family. Sometimes I lash out at my kids, or I'm very, very rude, and I'm just, you know, I don't like it. And they move. And that's why businesses are now seeing a very high turnover. The businesses that are burnt out and are struggling with this problem, doesn't matter how big their brand is, the reality is they have a very high absenteeism. So you'll
mhm,
find that over time, even if they have the same staff, more staff are reporting sick days and high staff turnover, very
mhm.
high staff turnover. People
Oh,
just
wow.
don't stick in the company for a very long time. And yeah, you know, as a brand, as an image, your clients, your customers will know about it. But the reality is, at this rate, you're not going to survive, and that's when the business starts crashing. So there is
Right.
a really strong, you know, business case in the sense that this isn't just a medicine or a health related wellness thing. This is
Mhm.
actually a business thing.
Yeah, yeah. My suggestion to people is, and Michelle will agree with me, is take those days. When you get mental health day, take them. If you get 1 or 2 days, I think you build up hours when you start working. Well, as soon as you reach 8 hours, take it. Go to the spa and chill out. Go to the hot and cold, mix and mingle with people
Yeah,
out there, eat some healthy food. Michelle, if you
absolutely.
have any question for Prianta, we have to wind down in the next 5 minutes. So, Prianta, what is Mindwell? What is Mindwell? Is it your own doing, like initiative that you're bringing across that people can reach out to you to to um to talk about like mindfulness, to talk about health, to talk about your mental health? What is Mindwell?
So yes, Mindwell is my own company, and we mostly use cognitive behavioral therapy. So we're not really going into a full-fledged, like I said, you know, treating just psychological diseases. We're actually trying to access people before they hit their absolute rock bottom, and it's classified that you have a specific disease and you're stuck with it for life. So it's a preventative approach, and the reason why we're, you know, talking about mind well is yes, we have a lot of awareness now about mental health and mental health issues like, you know, depression and anxiety and suicide, which is fantastic. But those are the end results. We want people to be well. So we're
Yeah.
flipping the script. We're not talking about, you know, the end result. That can still happen. There's a lot of genetic factors and things like that that can still give rise, but we're trying to get people to align themselves to be you know, well, and to sort of be better and stronger again, so that when, you know, they have things like chronic disease, stress, and they're put in those environments, they can break through without sort of, you know, getting into depression and anxiety and all of those issues.
Mm-hmm. Okay. So that's very good. So people, you can reach out to Prianta on LinkedIn. LinkedIn, type in her name, Prianta Ravi, and you'll find her on LinkedIn looking just like this on your screen. And you can email, what do you call it? Message her on LinkedIn, and she will get back out to you with all of this. What I do need people to do, because I think many people across the Caribbean asked me about this when they saw the flyer. and they saw dementia and Alzheimer's. If you need more information on it, reach out to her. If you want to reach out to me, I can connect you to her. She's very much available, even though she's in New Zealand. She's available for what do you call inquiries across the Caribbean region. She's in our network right now, so you can reach out to her. It's very good because I didn't know a whole lot until I started talking to her, and I figured out, oh my goodness, we won't mention too much about the medical aspects of it, the pharmaceutical drugs, but you might want to check out neuromodulation instead of feeding yourself with all those pills. You might want to do that. Not discouraging the intake of the pills, but the pharmaceutical company does, it's a multi-billion-dollar company that I see my people live on quite a bit when there are other options to some of the medication. Medication is good, but there are some other options for some of the things that we're really clamoring for medication. That is, there are options. Thank you so much for coming on. Priyanka, is there one last thing you want to say before we separate ourselves? And I'm gonna ask Miss Michelle Tolonil to say something as well before we close off.
Sure. So, just to wind down, when we talk about medicine, a lot of people think of, cough mixtures and paracetamol and things like that. Doesn't always have to be pharmacological. Healing can be done naturally, it can be done in different ways. So, what we're saying is the way the future of medicine is going, we're looking at the best way of healing now rather than just treating symptoms with pharmacological solutions.
Right.
Each will have its own benefit, sometimes it's a combination and we need to layer it, and that's where we're coming from. We're not doing a one size fits all that this is the solution, this is what you need to do. We're actually layering it. Why? Because we want people to actually get better, to heal and to recover rather than live with chronic issues, especially if they're psychological for a very long time, because it's very, very, very hard. It's challenging for the individual and it's challenging for the people around them. And that's when we will start developing things like depression and suicide. But if you can take care of yourself and take care of your environment and focus more on wellness and performing better, performance medicine, preventative medicine, then you can live a much better life. And that's what we're trying to focus on.
Definitely. Um, yes, Michelle, you're on. You're live.
Okay.
Yes.
Well, Dr. Ravi, I am so grateful that I'm on tonight and to hear you speak. My pastor always said, in order for you to remember something, you need to hear it 3 times. So I do hope that Dr. Dice bring you on 2 more times and let me know. So because you gave such great information, and I think it's information that we can need. Also, it is always good to have options. And I would love to hear more about your work, what you're doing, and other options. So that's where I want to lead. But I cannot end without telling everybody that registration is open. I'm seeking re-election for those who are connected anyway with Jamaica. You can go on the website is connectmeja.com and you can find information. If not, reach out to Dr. Dice and he has my information. But Dr. Ravi, it was indeed my honor meeting you. It was great information. Thank you.
Thank
Good,
you
good,
and
good.
all the best with the election.
Thank
Yes.
you.
All right. So everybody, this Miss Michelle Tolonil, representative from the Global Jamaica Diaspora Council, Northeast USA, and Dr. Priyanta Ravi, and she is a neuropsychologist, specialist for dementia and Alzheimer's disease. Thank you so much for being on, everybody, and the guest of Miss Michelle Tolonil, the all our guests that are on here. Thank you so much for being on. Thank you to the viewers on YouTube as well. Didn't see any questions. Maybe you're grappling with a few things and you need time to think. So thank you for coming on. We wish you all the best, and we will have more sessions like this. For
Mhm.
those of us who are males in the diaspora, male educators, we have in a conference in Jamaica It is from November 19th, which actually is the day it's International Men's Day. November 19th to the 21st, we're having that conference. You can go onto our website and you can register to be in that conference. It's a good way to make your way down to Jamaica and enjoy yourself in Kingston while you celebrate with us in the conference. It's just 2 full days and half a day. So for those of us who are in the diaspora, register now on edusolutionsintl.org. It's at Shortwood Teachers College in Kingston from November 19th to 21st. On the flyer here, it says 18th to the 22nd. Is actually the travel dates in that. It's built-in travel dates. So it's the 19th to the 21st. Register and come down and celebrate with the men. It's the very first of its kind. It's Regional Men in Education Conference that we have created here at ESI in partnership with the Caribbean Union of Teachers and the Caribbean Association of Principals of Secondary School. What good, everybody. We wish you all the best. Thank you so much for being on this mental health from burnout to brilliance forum. We'll have another session like this in a week or two with one of Dr. Priyanka is coming on back with one of our colleagues from California, and he will talk about how to treat pain, different types of pain. He's a psychologist too, and he will bring just a wealth of knowledge to all of us. So it's very, very important that we take in all of this and learn from it and start living healthy lives. And just a plug here, avoid processed food and ultra processed food. Please, please avoid them. I beg of you, my people. All right. Take care, everybody. We'll see you later.
Bye
Yeah.
bye.
All right,
Bye-bye.
and send me your questions. I see a lot of people who haven't we haven't been able to go through their questions.
Oh,
So get
yes.
in touch with Dr. Diane.